Yesterday, Air Commodore Webb and I visited Hamilton. We met with people and various stakeholders in the city, including iwi, the Mayor, the DHB, police, NZDF personnel and hotel staff, as well as clinical staff at the facilities. We visited one of the hotels that is currently stood up and a future hotel that will come online soon. And we're also looking at other centres where we may have to stand up facilities. We're investigating the feasibility of Queenstown and Dunedin as other centres where returnees can safely stay in managed isolation as they join us in our coveted position during this global pandemic. And it is our intention to visit these centres next week. In terms of the regular information updates that we've been talking about, you'll have the data sheets that will be available every day on the Unite Against COVID website. This shows you the number of people in managed isolation and quarantine and what centres in New Zealand they're in. It also has the projected flows of incoming returnees and outflows from the facilities. You will also see that we are detailing how the actual returnee levels match up with our projections. And there's also the testing data from the Ministry of Health there as well. There's a lot of interest in the hotels that are being used in the areas where we have managed isolation, and we're working to get that information regularly posted on the Unite Against COVID website as soon. Next week, we plan to prioritise the reinstatement of compassionate exemptions and the work that is required to do that. We know that this is a matter of enormous concern for those people who are seeking these exemptions. It is also of public concern, and it is our absolute priority to ensure that these can safely go ahead. In terms of other work, we've been working with ESR and the Ministry of Health to have a fast lane prioritisation at the labs for the samples that are sent from the hotels, particularly those day 12 samples, so we can ensure they're back and the results are back for day 14 release. By next week, we're also aiming to have the appropriate testing equipment installed at Auckland's Jet Park Hotel to monitor wastewater samples from COVID as a further layer of monitoring at the facility. And this is a method that is being developed by ESR as part of the Government's Science COVID Innovation Fund. And I will now ask Air Commodore Webb to give you an update on the operational matters.
Thank you, Minister. As of today, we have seen 24,710 New Zealanders return home and go through managed isolation and quarantine since the 26th of March. There are currently 5,305 people in managed isolation and quarantine. Our current capacity is 6,058, and this gives us an excess capacity of 753. Over the next 7 days, the projected total net increase will be 1,176, with a projected total number of people of 6,481 and projected capacity of 6,774, and this will give us a projected net capacity of 293. We continue to work closely with Air New Zealand on managing arrival flows and how the private sector could help with booking systems. We now have a total of 24 managed isolation and quarantine facilities in 4 different regions. Over the next week, we are planning to increase this to 27 over these regions. As the Minister has indicated, we are doing a feasibility study into facilities in Queenstown and Dunedin. We've had 815 day 3 and day 12 tests completed yesterday, and this is slightly over the planned required number of 785. Resourcing also continues to increase. As of today, we have 288 New Zealand Defence Force personnel across 24 facilities, and they're providing 24/7 coverage across shift rotations. The total number involved across the Defence Force system is 338, and this includes people supporting, planning and assuring at the national level. There are also more government staff across the end-to-end system. All parts of government are supporting this critical mission, just as we did during alert levels 3 and 4. A senior officials meeting will take place this afternoon to discuss the resourcing requirements further as part of this all-of-government response.